Welcome to Olean General Hospital. I'm Dr. Coolidge, and I've been an emergency room physician here for 5 years. I want to take this time to walk you through the emergency department process so that you're able to understand exactly what to expect. As you arrive in the ER, you'll be greeted by one or more of our staff members. Here, our patient account representatives will gather information about why you came to the ER and other demographic data. This will be entered into your health record. Obtaining this information is crucial when the ER team is trying to treat and diagnose you. Our account representatives are unable to treat or diagnose any illness, but they are able to reach out to the clinical staff of nurses, physicians, and other providers if it is determined you need an immediate review of symptoms. Next, you'll see a triage nurse, who is an experienced and highly trained emergency room nurse. This nurse will ask you questions about your symptoms, how long you've been experiencing them, and other related questions. The triage nurse will check your temperature and your blood pressure, take your oxygen levels, and your heart rate. This process generally takes 3 to 5 minutes. All this information is used by the triage nurse to decide what order the patients are brought back to the emergency room to be seen by providers in the emergency department. Remember, in the emergency department, patients are treated based on how sick they are, not who arrive first or who arrive by ambulance. The sickest patients are seen first. Many patients could be in the waiting room, and the latest arriving patient might be brought back before you or the longest waiting patient, simply because of how sick that person is compared to everyone else in the waiting room. Please be aware that not all patients enter the ER on their own. Some patients do arrive by ambulance. However, one mode of arrival does not guarantee to be seen any faster. The critical status of every patient is considered when assigning a bed to ensure that the most critically ill or hurt patients are seen and treated first. The triage nurse coordinates with the charge nurse to place you in an available room in the ER. If the emergency room is full, you may be asked to return to the waiting room until a bed is available. If the emergency room is really busy, you may end up having tests completed in the triage areas such as blood work, x-rays, and EKGs. You may then be sent back to the waiting room until the patient room is available. Having these tests started in the triage or waiting area expedites your care and reaching a diagnosis as quickly as possible. In the emergency room, you'll be seen by a medical provider. This could be a doctor, nurse practitioner, or physician assistant. Regardless of which medical care provider is assigned, your group of providers are highly trained and qualified to treat any and all emergency situations. The provider will do an assessment of your complaints and may order tests to be completed. Tests commonly completed in the emergency room are blood work, x-rays, EKGs, urine tests, nasal swabs, throat cultures, and CT scans. As mentioned earlier, some of these tests may have been started or completed while you were in the waiting room. If blood or urine specimens have not been collected in triage, an RN will start an IV and collect your blood, or one of our ER technicians may collect your blood using a simple venipuncture. If you are presenting with a respiratory condition, the provider may ask for a flu or COVID test, which requires a cotton tip swab to be gently placed into the nose to collect a specimen for the lab to test. These tests are generally completed in 1 to 2 hours. During this time, your provider may discuss your care and treatment options with other medical providers and specialists that specialize in your particular condition. Your provider will use these results and their assessments to determine the best way to help you get better the fastest. Sometimes this might mean that you have to stay in the hospital for treatment, or you may be sent to another hospital that specializes in your condition, or you may be sent home with medications and instructions for follow-up care. If you are admitted to the hospital, the provider from the medical floor, also known as the admitting physician, will see you in the ER, discuss your diagnosis and plan of care, and write admission orders which include a plan of care specific to you. Once the decision to discharge you from the emergency department is made, your provider will speak to you about how the decision was made, your diagnosis, any medications ordered for you for home use, and where the prescriptions are to be sent. They will also discuss follow-up care with you. A registered nurse will then review all of this information a second time prior to leaving the emergency department. This last review gives you a chance to ask any additional questions, review your home and follow-up care, and receive any final care prior to being discharged. Your nurse will also ask you to sign a simple form to confirm receipt of your discharge paperwork. Oftentimes, it seems like you have to wait a very long time to be seen in the emergency department. This is because there are often unexpected emergencies that require the immediate attention of our providers and nurses. This may cause a delay in treatment of other patients who are waiting. Sometimes there are delays in getting the results of testing that have been requested by your provider, such as labs or x-rays. When this happens, the nurses and providers will be working hard to get the results as quickly as possible. This is done by contacting the appropriate departments and finding out what the delay is. Remember, even though there may be delays in your treatment, our staff are working hard to get you the treatment that you need and get you feeling better as quickly as possible. We hope this overview of what to expect during your stay in the emergency department has been educational and helpful. Thank you for choosing Olean General Hospital for your care today.